nurse practitioner. Can you tell me your name?
My name is Cashlyn.
Hi, Cashlyn. I'm going to wash my hands, and do I have your consent to video this?
Yes, you do.
Perfect. Okay, we're going to start our neurological exam, okay? First, I'm going to assess her level of consciousness. She's clearly alert. Next, I'm going to assess your orientation. You already told me your name, so she's alert and oriented to person. Can you tell me where you're at?
I am at your house.
Perfect. And can you tell me what day of the week it is?
Monday.
Okay. And can you tell me what are you doing here?
Hanging out with my aunt.
Okay, so she's oriented times 4. Next, I'm going to move on to her speech. Her speech is clear and articulate. We are then going to move on to memory. So what did you have for lunch today?
I had popcorn, chicken, and rice.
Perfect. So that was testing her recent memory. And then we're going to test remote memory. What city were you, or where were you born?
Waterman, but it's now called Advent Health.
Perfect. Okay. So now we're going to move on to our cranial nerve assessment. We're going to first test cranial nerve 1, which is olfactory. So I'm going to take 2 scents and I'm going to have Cashlyn smell them and tell me what she thinks they are.
Cinnamon.
Perfect.
Garlic.
Lovely. Cranial nerve number 2 is our optic nerve. We're going to do the Snellen chart. And we're going to do this at 6 feet because I have the handheld chart. So first, Cashlyn, I'm going to have you cover one eye and read the lowest line you can read.
L, T, F, P, H.
Perfect. Next eye.
L, T, F, P, H.
And both eyes.
L, T, F, P, H.
Lovely. Okay, 20/20 on all 3. Perfect. Next, I'm going to have you cover your left eye. I'm going to cover my right eye to mirror her. And you tell me when you can see my hand.
I can see it.
Perfect. And next.
I can see it.
And both.
I can see it.
Lovely. Okay. Now we're going to do our ophthalmoscope assessment. So I'm going to practice safety. I'm going to dim the lights, and then I'm going to do right eye to right eye, left eye to left eye. So your left eye to my left eye. You're just going to look right at me, and I'm going to shine, okay, and I see the red reflex, and the vessels, and the optic disc and cup. The ratio should be 3 to 1, which it is. The margins are sharp and orange. Next one. Right eye to right eye. Okay, don't want to blind you for too long. Okay, found the red reflex. And same thing, the optic disc and cup, the vessels, the retina, the lens, and that's it for our ophthalmoscope assessment. Next, we will move on to cranial nerve number 3, which is going to test our extraocular eye movements. And this is going to test for all the eye movements in the 6 cardinal gazes besides down and medially and lateral eye movements. So, let's test. I'm going to have you follow my finger. Perfect. And in, out, up, and down. And like I said, the cranial nerve 3 is testing for most of the extraocular eye movements besides lateral and medial and down, which will be cranial nerve 4 and 6. I'll go over that. Then I'm going to test for pupillary reaction. So you're just going to look right at me. And I'm going to check for direct first. And perfect, and perfect. And then consensual, so I'm going to shine my light into her right eye and look for a response in the left. And opposite, perfect. Everything was equal, round, reactive to light, and accommodating. And I don't know any nystagmus, so we will move on from there to cranial nerve number 4, which is trochlear. So trochlear is going to test for any downward motion of the eye and any medial motion of the eye. So I'm going to have you look down, yep, and down. Perfect. No nystagmus noted there. And then we'll go to cranial nerve number 5, which is trigeminal. So I'm going to test the forehead, the cheek, and the jaw for sharp versus dull. So I want you to do me a favor, and you tell me what you feel, okay? Is this sharp or dull?
Dull. 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 Dull.
And then to round out trigeminal, I'm going to have you open your mouth against resistance. Perfect. Okay. Everything feels good there. We're going to move on to cranial nerve number 6, which is going to be our abducens. So this is going to be our lateral eye movement. So out and out. And no nystagmus noted there. Then we're going to move on to number 7, which is our facial. So facial, I'm going to have her do 2 motions here. Wrinkle your forehead and puff out your cheeks like this. Perfect. Lovely. Next is our cranial nerve number 8, which is vestibulocochlear. So I'm going to test Cashlin's hearing. So first we're going to do the whisper test. So I want you to cover one ear for me. Ooh. And I'm going to say a word and you tell me what I said.
Baseball.
Okay, other?
Apple.
Perfect. And then we're going to do Weber. So, I'm going to strike this, put it on Cashlin's forehead. Can you hear that?
Yeah.
Do you hear it the same on both sides?
Yeah.
Perfect. Okay, so it should be the same on both sides. There should not be any lateralization that could indicate some conductive hearing loss. Next, we're going to do the Renee. So I'm going to place this right behind your ear on her mastoid bone. You tell me when you stop hearing it.
No.
Okay. Can you hear it? Tell me when you stop hearing it.
No.
Okay, perfect. So that's normal because ear conduction should be greater than bone conduction. Same thing. Tell me when you stop hearing it.
No. No.
Perfect. Okay, lovely. So those were normal findings there. We're going to move on to cranial nerve number 9, which is going to be glossopharyngeal. And then we're going to move on to cranial nerve number 10, which is vagus, which both look for pretty much the same thing. So with 9 and with 10, I'm going to have her, I'm going to peek at her uvula. And let me grab this. Okay. And I'm going to have her say ah. And then I'm going to test her swallow reflex. Okay. All right. Say ah. Perfect. Okay. And can you swallow? And normally I would test her gag reflex as well. We'll just verbalize that though. Then we're going to do cranial nerve number 11, which is accessory. So I'm going to do 2 different things here. First, I'm going to have you turn your head, and I'm going to try to resist. Turn your head. That way. Okay, and then the other way. Perfect. And then try to shrug your shoulders when I resist. Perfect. So everything checks out good there. Cranial nerve number 12 is going to look at her tongue at midline, and then I'm going to have you press on my hand too. So, yep, tongue looks good. And then you push on my hand with your tongue. Oh, tongue. No, like in your mouth. Yep. Perfect. Okay, so that's our cranial nerves. Next, we are going to move on to your gait. I want to see you walk. Okay, so I'm going to have Cashlyn, let me move this blanket. All right, I'm going to have you walk towards me. Perfect. Okay, so nice and coordinated. And then I'm going to have you back up. Oh, you can just back up. I just try to make sure we're in the light. Okay, okay, so do a tandem walk. So you're going to do heel to toe, come towards me. Okay, perfect. Okay, and then walk on your heels. You can go this way if you want. Yep, and then walk on toes. Okay, perfect. Looks good. Okay, next is something called Romberg. So you are going to close your eyes, and I'm just looking to see if she's swaying, if she gets dizzy, if she starts to fall over, but you look good. And in a normal patient, I would definitely hold on to them just in case there is any Romberg drift there. Okay, pronator drift is next. So you're gonna hold your arms out, close your eyes. And no swaying, everything stays symmetrical. Okay, perfect. You can sit back down. Okay, next we're gonna do rapid movements. So you're gonna take your hands and you're just gonna flip them over. Yep. Looks good. Perfect. Okay. are going to, I'm gonna have you close your eyes and we're gonna test joint position sense. So I'm gonna take your hand. You tell me what way I'm moving your finger.
Up. Down. Up. Down.
Perfect. Okay, and I'm gonna grab 2 pens here and I'm gonna test 2-point discrimination. Okay, you tell me if you can feel this, okay?
Should I close my
looking.
eye?
Yeah, you can.
Yeah.
Okay, lovely. And then I'm gonna test to see if she can tell what I'm tracing on her hand for aphastasia. Okay, so close your eyes. I'm gonna trace something on your hand. You tell me what it is.
Circle.
Perfect. Okay. All right, after this, I'm going to move on to sensory. And we're going to do sharp versus dull on the upper extremities first. Let me grab this. Okay. Okay, you tell me what's touching you, okay?
The dull paper.
Mm-hmm.
The dull paper. Metal. Metal.
Sharp.
Sharp metal.
Okay. Okay. Perfect. And then I'm gonna move on to lower. Close your eyes. Yep. Or yep.
Dull paper. Dull paper. Sharp metal. Sharp metal.
Okay. And then tell me if you can feel this. Close your eyes.
Yeah.
Mm-hmm. Mm-hmm.
Mhm.
All right. Awesome. Okay. So that was our sensory of our upper and lower extremities. And now we're going to move on to our motor of our upper extremities. So we're going to look at our biceps, triceps, and deltoids. So we're going to do strength, okay? So with your arm, I want you to pull against me. Yep, so bicep strength is there. And then push against me. Other way. Yep, so tricep is there. Same thing. Bicep, and then push the other way. Yep. Yeah, other way.
Yeah.
Yeah, tricep. Okay, and then you try to push up with your shoulders like this. Okay, and then try to close in on them. Yep, perfect. Okay, so that's our strength. Everything was symmetrical bilaterally. And then I'm gonna do your hand grip. Can you grip my hands? Okay, everything's equal, symmetrical here. And then finger strength. So I'm gonna hold your fingers, you try to separate them. Yep, lovely. Okay, looks good. And then we're gonna move on to our lower extremities. So our quads, our hamstrings, our abductors, and our adductors, okay? So we're gonna do strength.
Okay.
So with your quads, you're gonna lift your leg up against resistance. Yep, so that's testing her quads. And then you can just keep it up and then come back, and that's testing her hamstrings. And then same thing, up and back, perfect. And then I am going to have you push your leg out. Okay, you can do both at the same time, that works too. And then back in, okay? Lovely. Next, we are going to do our reflexes. Let me grab this, okay. So we're going to do, I'm just gonna have you relax, like all your weight is on me, okay? Tricep. Okay. Bicep. Perfect. And next, we're going to do, and then again, all the way up. Perfect. Okay. All right, after that, let's do your patellar. Okay, so I'm just gonna strike your knee. I'm sure you've had this done before. Try to scoot back so that your legs are like dangling.
Yeah.
Yep. Well, it's kind of hard. Okay. Ooh. Okay. Perfect. Okay. Now I'm gonna do back behind your heels, your Achilles, okay? Okay, and then last one, I'm gonna take the bottom of your foot, and I am just gonna do the Babinski here. Yeah, so her toes did exactly what they're supposed to. Okay. All right. And that concludes our neurological assessment.